Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I will be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy, all the way from South Africa today. How are you doing, Not South Africa. How are you doing, Dr. Murphy?
Nice and warm here. It's the end of summer.
Very nice. Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and U.S. COVID statistics through today, March 14th. We invite you to submit your questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with the updated COVID statistics in the US. Average new hospitalizations per day, 2,504. In the same week last year, we saw 3,437. Average COVID deaths per day, 131. Same week last year, 308. New vaccine uptake. For adults, 22.6%, for those 65 plus, 42.4%, and 13.5% among children. Dr. Murphy, your reactions to those numbers?
No big change from last week. The numbers continue to sort of drift slowly downward, which is exactly what we expect in March. By the end of March, there should be a more significant drop-off in hospitalizations and infections as we hit the spring. The number of people vaccinated just up a little bit, but certainly not enough. But, we're about stable.
Mm-hmm. And some very big news out of the CDC this week. We talked a few weeks ago about some speculation in two changes in the COVID isolation guidelines. Those have officially been changed. Can you please break down the changes for us?
Yeah, so we used to say 5 days of isolation. Stay at home, away, don't go to work. 5 days more with wearing a mask everywhere. Now, the federal government, the CDC, is following what happened in California and Oregon and other places that they're saying, if you feel better and your fever is gone for 24 hours, you can go back to work. You may wear a mask if you're around other people or in close quarters. It says a couple of things problematic with this. It says that, may wear a mask. I mean, come on. You either wear a mask or you don't wear a mask. This may wear a mask. I really think that's a very confusing statement. And what do you do if you're still testing positive? If you test positive with one of the over-counter tests, there's a much higher likelihood that you're contagious. So I don't know why that's not in the guidelines. The data are out there to support that. The tests are available now. It doesn't make any sense to me, but those are the guidelines. They're trying to simplify everything and not confuse people, but I think it's a little short-sighted, but that's what it is.
Mm-hmm. We'll have to wait and see if there are any big changes as an effect of this change in isolation guidelines, but only time will tell.
Right.
Next, there was a massive study on vaccination, COVID vaccination, and its effect against long COVID and preventing it in children. Can you break down those results?
Yeah, so this is a study from the journal Pediatrics, big journal, very important journal in the pediatric field. It involved looking at data records from 17 health systems, including our own at Northwestern. It involves over 1 million different children, kids from 5 to 11 and kids that are adolescents 12 to 17. And what they found was that long COVID was occurring about 4.5% of the time. Vaccine efficacy, preventing the complications, was between 35 and 41% based on age. They also noticed that this effect appeared to wane over time. So a couple things out of this. One, the vaccine works. That's great. Long COVID is about 4.5%. That's not so good. The effect drops over time. So kids are going to need a booster as well. So, but that's a massive study. That's a really big study. So that means it's a powerful study. And the data are what they are. And that's the story with the vaccine with kids. It does help. And we'll see.
Mm-hmm. Now, there was a little bit of a funny result of the COVID pandemic, which was when people were isolating, they were taking all of these precautions. It also had an effect on other infectious diseases. There was news that one of the influenza B strains that's usually in the quadrivalent flu vaccine may no longer be needed. Can you tell us why that is?
Yeah, I don't know if people remember, but early on in the pandemic in 2020 and 2021, flu almost went away. The COVID outcompeted the flu. And there was just like all of a sudden no flu. Not only did it outcompete, but because people were mitigating and wearing masks and not in big groups and whatever, flu just kind of disappeared. Then as things loosened up, it came back. But it came back with one kind of funny thing. So there's flu A and flu B. In flu B, the strain that they were interested in is the Yamagata strain. And that has apparently disappeared. It didn't come back. The COVID pandemic wiped out Yamagata. So that's great. And so what the proposal is to take it out of the quadrivalent vaccine. So they won't, why bother if you don't have it? And then another little point about that is that if you wanted to keep it in, you would have to keep growing Yamagata flu strain. Like, it's already gone from the environment. Why do you want to keep a lab growing it? It's just not necessary. So they're probably going to take it out of the next season's flu vaccine. So it just disappeared.
I mean, it's a little bit crazy to see. Now, the next study also had some really great numbers. The CDC recently released new real-world data on the efficacy of Beyfortus, the RSV monoclonal antibody for infants. Can you break down those results for us?
Yeah, well, they continue to look at this. The same thing has been reported. Remember, RSV causes 2.1 million outpatient visits per year in kids, 58 to 80,000 hospitalizations, and 1 to 300 deaths in children. Remember a year or two ago when all the pediatric ICU beds and hospital beds were taken up with RSV patients? Because of Beyfortus, that's not going to happen if people take it. And it's been widely accepted in the population. So that's great. We've got a therapy that works really good, and RSV can be very devastating in children. So this is just great news, just confirmatory news, what we already knew.
Mm-hmm. And on the other hand, with RSV, the other group who is highly at risk are older adults. There was another study that came out detailing the efficacy of a single dose of that RSV vaccine. Can you break it down?
Yeah, so RSV vaccine in adults was approved a little over a year ago for people 60 years of age and older and people at high risk. And one dose, I had it myself, just one dose, and also very effective. So it works for 2 years. And remember, before the vaccine, RSV in adults caused 60 to 160,000 hospital admissions per year and 6,000 to 10,000 deaths. So a very serious disease in people over 60. So this is just more good news that this vaccine works. You've probably seen the advertisements on television and stuff encouraging people to get it. So it's just another thing to get, but it looks like you're not going to have it more than once every 2 years and maybe even longer. We'll see. Hasn't been out for 2 years yet.
Yeah, that's certainly great news, and we will stay up to date on any more research that comes out on the topic. But switching gears to a topic that we have been talking about week after week now, measles. There are more measles cases in the US, and there is now an outbreak here in Chicago. Can you tell us about the newest cases?
It's really bad. So we're up to 47. So that's about how many we have in a whole year, and we're only we're not even 3 months into the year yet. And it's all over the place. It's in Chicago. We're up to about 8 cases. That includes some adults and children. You've probably been reading about it in the local papers and the news. The CDC has just sent a team of investigators to help the Chicago Department of Health deal with the issue here. Measles is highly, highly contagious. It's as contagious or more than COVID. And if you've never had measles before, measles can be quite debilitating. You can actually get encephalitis from measles. You can end up in the hospital. Matter of fact, one of the cases is in the hospital here in Chicago. Florida has 12 cases. They even have more than Chicago. And it's all about being vaccinated. Who's not vaccinated? So the herd immunity about measles means that you can have a little mini epidemic like we're having when the herd immunity drops below 95%. And we are below 95%. And then in these migrant communities, these people that have come up and cross the border and whatever, a lot of them are not vaccinated. So, they've got to get vaccinated, but, this can spread to anybody who's not vaccinated. And that's the whole problem with measles. If you don't want to take a vaccine, what happens to you is your business or your kid. Yeah, that's your personal decision. But when you get measles, you can spread it to other people who are also not vaccinated. Now, if you are vaccinated, you don't have anything to worry about. Measles protection lasts basically forever. So you had measles as a kid or you had a measles vaccine, don't worry. But if you haven't had the vaccine, you should worry.
Mm-hmm. Just one dose of the measles vaccine is 97% effective at preventing disease, and 99%. It's really astounding how effective they are.
Very effective vaccine, even with one dose.
Mm-hmm. Now, moving on to our final story of the week. After decades of research dealing with this illness, we still do not have a solid vaccine or treatment for HIV. Can you tell us why that is and what the positive buzz is all about in this area right now?
Well, we have treatment, but we don't have curative treatment.
There we go.
We have suppressive treatment. So that's one thing. But we've had 40 years of attempts to make an HIV vaccine. $17 billion has been invested in HIV vaccines, and none of it has worked. Now, at the recent AIDS meeting in Denver, there was a report that some new vaccines may produce what they call broadly neutralizing antibodies, and that this may suppress, may increase the protection, excuse me, for, may protect people from getting HIV. Very encouraging, but they're at such an early level. It's going to take 5+ years before this translates into any kind of product, if it really works. So we have a ways to go. I think it's very encouraging. They've found another potential type of vaccine, but don't get your hopes up too high. And we got to keep working on developing a good vaccine for HIV.
Mm-hmm. It's good to hear that there is some positive news, some positive results coming out of those trials, but it's important that over the past 40 years, there have been some positive results and they have not turned out. So like you said, we have to manage our expectations regarding this one.
Just throw your hands up and give up. You just put your head down and learn from your mistakes and go forward. We've got to get a vaccine because there's still more new AIDS cases per year, HIV cases, HIV infections per year than there are deaths. That means that the overall number in the world is still going up.
Wow. Wow.
Mm-hmm.
Well, on that note, Dr. Murphy, thank you very much for your expertise breaking down these questions, the articles, the statistics. It's much appreciated as always. And thank you for joining us all the way from South Africa.
Well, thank you.
Thank you, everyone, for joining us as well from wherever you are. We hope you enjoyed today's episode. If you have any questions, please feel free to leave them in a comment down below or select any of our social medias in the description to contact us. Thank you and have a great weekend.
Thank you.